Welcome to the Health Wealth Podcast and Radio Show with Forbes author and contributor Dr. Josh Luke, America's Healthcare Affordability Authority. Visit drjoshluke.com for information on speaking appearances and other resources.
It's Dr. Josh Luke here with the Health Wealth Podcast and Radio Show. Thanks again for joining me. This is episode 6 of our Health Wealth Basics series. It's actually the final episode in the Health Wealth Basics series, and the series was created just really to give you kind of the basics on where to start your health wealth journey when you've identified that your company has significant wasteful spending on healthcare, and that you know you can save 30, 40, maybe even 50% as an alternative to getting that annual 10% increase letter from your broker. That's where the health wealth journey begins. So today we're going to talk about, on episode 6, in the final episode in the series, we're going to talk about the tools and resources available to you as you begin that journey at health-wealth.com. So start by going to health-wealth.com. The first thing you're going to see on there, the first tool, is this book, Health Wealth: Is Healthcare Bankrupting Your Business? 9 Steps to Financial Recovery. It's published by Forbes Books. And I'm really grateful that Forbes came to me and asked me to write this book. And remember, I'm a hospital CEO of 10 years, so I was really fortunate to become a CEO when I was 32 years old. And I asked a lot of questions. And when Forbes came to me, it was 10 years later, and I was still asking questions. And I said, hey, why me? Why am I the guy that you think could best educate American businesses on how to save significantly on healthcare spending? And it's really exposing the underbelly of the lack of transparency with hospitals and insurers, and making sure that your broker is bringing all these solutions that we're about to talk about to you. And your broker can help you significantly. But for the most part, brokers are waiting for you to ask because there's so much to choose from. And that's really where one of our tools, the next tool, the loss assessment, can help. Our prior episode was specific to the Health Wealth Loss Assessment. It's just a short assessment that takes you 5 to 15 minutes, and it gives you really a sneak peek into the vulnerabilities you might have on your wasteful healthcare spending. So when you talk about tools at health-wealth.com, you have, first of all, the book. The book's available on Amazon.com. It's Health Wealth: Is Healthcare Bankrupting Your Business? Then you have the loss assessment, which is free to take. You can just go on and take it. It takes a few minutes. And we also have an interactive series that will launch by the end of February 2018, the 9 interactive steps to health wealth. And they're the exact same 9 steps we talk about in the book, but really they're done in an interactive way, so you as an individual or your entire team can participate in these interactive steps to health wealth and really have a better understanding for them. Because remember, what the loss assessment will do for you is help you identify which of those 9 steps, or which 2 or 3 of them, might be the best fit for your organization. So I'm really excited for you to do the loss assessment and to get a better idea of which those might be. We also have Health Wealth Partners, and I'm here to tell you today that while I am the person who founded health-wealth.com and the Health Wealth movement, I am an expert in healthcare transformation, and I'm also becoming an expert in how to help Fortune 500 companies save money through a network of friends that have been doing that and doing it well in their little silo for years. And so it's bringing all those silos together to one central point where we can say, hey, which of these silos makes the most sense for you, that we're attempting to do here at healthwealth.com. And so Health Wealth Partners is really, when you've done that loss assessment, you've done the interactive steps, and you say, Josh, we'd really love for you to bring that team of experts in here and apply some of this to us, because it really is turnkey in many cases. And let me give you some examples. So those are the resources we have. I can also come speak or meet with your executive team. That's one of the other resources available in the Health Wealth shed of tools, if you will. Once we get beyond that, though, the only other tool we have really at this point is the podcast and radio show, which you're listening to now. And after this series, you're going to start to hear from some of those experts from around the country. You're going to hear from Ryan Miller with Centennial Benefits, who is a phenomenal mind when it comes to creative approaches to healthcare spending for mid-market and Fortune 500 companies. You're going to hear from Mike Ochoa, one of the leaders in direct primary care on the West Coast, who also took that direct primary care model and expanded it, kind of primary care on steroids, where they're direct primary care on steroids, where they're also providing an enhanced pharmacy benefit manager component for those of you that are working with the PBM. You're going to hear on the podcast from Dave Chase, who many of you know from LinkedIn and Twitter. He's great on social media. You know me, I'm a big social media guy. Dave and I have met before. We communicate a lot. He is the founder of Healthcare Rosetta, also a not-for-profit. Healthcare Rosetta is talked about in Health Wealth, 9 Steps to Financial Recovery. There's a whole chapter that talks about really doing a complete audit of all the healthcare spending your organization's doing, and Dave's organization, the Rosetta, does that for you and does a good job of it. And it also introduces you to some of these other steps that we've talked about once they've done that audit. You're going to hear from other individuals that might work in artificial intelligence, that might be experts in telehealth and remote monitoring. And even as we get to the final step, integrative medicine and naturopathic medicine, you're going to hear from Kyle Hill, the CEO of Harvey, an integrative medicine company, and maybe from his partner, Mike Townsend, his co-founder, about how Eastern medicine's making a comeback. And a lot of people go, oh, Eastern medicine, that's crazy. No, it's only crazy because in the 60s and 70s, Big Pharma convinced us as Americans, and I'm a Gen Xer, as most of you know, Big Pharma convinced the boomers and Gen Xers that if you're sick, the only way to get better is to take drugs and pharmaceuticals. What you don't know, and what you'll learn when you research integrative medicine, it was a huge movement in the United States prior to then. There was tons of universities, more than 100 specific to integrative medicine and naturopathic medicine. And what we're finding at Health Wealth is when you combine integrative and naturopathic medicine with Western medicine, hospitals and pharmaceuticals, you're going to have a much healthier workforce. And so one of the steps that we encourage in Health Wealth is to offer an integrative medicine consult for your employees as an incentive or a retention reward after a year or two on the job with you. And you'll find lots of different strategies of that nature in the Health Wealth books. You know, another tool I haven't mentioned yet, because it's not going to come out till September of 2018, is my next book called Health Wealth. Is Healthcare Bankrupting Your Family? And you know what's cool about both of my books, the business book and the family book? The answer to the title of my book is yes. Health Wealth, is healthcare bankrupting your business? Yeah, every business in the country. Health Wealth, is healthcare bankrupting your family? Yeah, every family in the country is overspending on healthcare. So it's cool to come up with a book title, and a provocative one at that gets people's attention with an obvious answer. And the fun part is doing that research and meeting all these great minds from across the country that I'm going to introduce you to that can help you on your personal journey for your business to Health Wealth. So check out those tools at health-wealth.com. Start by doing the loss assessment. If you haven't read the book, check out the book. The interactive series that'll be there by the end of February is great. And if you're interested in learning more come September, we're going to release the book for your family as well. So those are the tools we have. Turn it into the Health Wealth podcast and radio show. It's found at health-wealth.com as well. And we're going to continue to introduce you to these experts from across the country that are not only introducing you to the folks that are actually carrying out these turnkey programs, but they're going to make sure that your company is well on its path to Health Wealth. They're going to help you save significantly and help your workforce become healthier. So thanks for joining us on this final episode of the Health Wealth Basics series. I'm really excited that you've made it this far on the Health Wealth podcast and radio show. And the fun part of the podcast begins now as we start to bring in some of these experts. So stay tuned. Over the next few weeks and months, we're going to bring in lots of experts that can help you on your journey to Health Wealth. It's Dr. Josh Luke on the Health Wealth podcast and radio show. Thanks again for joining us.
Thanks for tuning in to this episode of the Health Wealth podcast and radio show with Forbes author and contributor Dr. Josh Luke, America's Healthcare Affordability Authority. Visit drjoshluke.com for information on speaking appearances and other resources.